In your health this morning, if you've ever considered getting breast implants, then you know that there are options out there and a great deal of controversial information as well. We know this is a major decision, so who do you turn to? What kinds of questions should you be asking? Well, this morning we have invited Dr. James Nachbar, who is a mentor to many plastic surgeons all over the nation, to help us understand gel versus saline breast implants. Good morning.
Good morning.
We know that these gel implants right now are going through some medical trials, but what is the hot topic surrounding them?
Well, the big news these days has been sort of the fact that over the last several months, the FDA has concluded, after a report of their medical panel, that the implants are going to be safe to remarket, and both manufacturers have been given letters indicating that their applications to remarket the silicone gel implants look like they're going to be approved.
Okay, I got to tell you, my worry when we talk about silicone ever associated with breast implants, because of all of the negative hubbub surrounding this, I would imagine there are a lot of women and men there saying, oh, wait a second, should I be nervous here? And you say no, right?
Well, I think every woman has to decide for herself what she wants to do, and that's really what the FDA has concluded. These implants are reasonable devices to be used, and then anybody considering any implant or any surgery at all then can make the decision themselves whether they think that they're reasonable. I know there's been concern, people have miscommunication, misunderstanding of the concern. The big concern in the early 90s that was raised was that the implants might result in autoimmune diseases, things like arthritis, lupus, things like that. The silicone could react to the body's immune system in some way, cause those diseases. Right. There have been a lot of studies since then, and none of them have really shown any higher instance of any diseases like that in any woman with implants compared to people without implants.
The good news is that research is being done, and we are getting some answers out there, but there are some questions about the gel implant. You have brought in some examples here. What do we look? This is the gel implant.
That's a silicone
right?
gel breast implant.
Okay.
This obviously is a sample that we have, and you can see it's soft, it's sort of more flexible and
sure.
Moldable.
A lot more durable.
Well, I think more durable in some ways than the other implants that have been used in the past.
This is just fascinating. I mean, we've got so many people in the studio just looking at these things going, whoa, that's so fascinating as to what they really look like.
And this is an implant. They're all very durable. You can't.
Holy Moses!
You can't break them.
Okay.
And of course, stick them with a needle, they won't tolerate that. But they're very, very strong.
This one here, though, this is not the silicone.
Right, that's a saline or saltwater type implant. This particular sample has some air because they get air in them. If you hold it upright, you'll see.
Oh, you can see the bubble right there. Can you see that? Yeah.
In the body, they won't have that, of course. And then they do have more wrinkling. You can see the difference. They're just not the same softness as the gel implant. On the other hand, many, many, many people have had the saline implants and been very happy with them.
Okay, so what's the cost difference?
There is a cost difference. These implants are $850 a pair, and these implants are $2,000 a pair.
Oh, okay. Why?
That's what the manufacturer's charging for them.
All right. Now, let me ask you this. I would imagine, because with the way this one moves, it's going to look a lot more natural. But who is the right candidate for this compared to this?
Well, each person has to decide for themselves what they want to do. The big advantage of these implants is they do have less wrinkling. For a woman with less tissue present, someone who's had breast cancer, for instance, and a lot of the breast tissue has been removed, this is a great implant. Someone who needs a breast lift, and again, the tissues are thin, this is a very nice implant for those reasons, because it is softer.
To go in under the muscle?
Well, mostly put the implants under the muscle to provide more coverage. But even a saline implant put under the muscle in someone who's very, very thin or has had a lot of tissue removed, the wrinkling is going to be more visible with the saline implant.
Okay, and last but not least, what do you think is the most important information we're getting through these medical trials that you've been a very important part of?
Well, I think a lot of plastic surgeons have been contributing and have enrolled our patients in these protocols to get the information. The big information is that the concerns people had about lupus, arthritis, there were questions raised about cancer and so forth, none of those have really been borne out. If there are problems with these implants or any implants, they're mostly localized problems related to the implant. And I would say that my experience has been that very few people that have the implants then choose to have them removed regardless of problems, even if problems occur.
Okay, now we do know that 1.5 million women here in the United States do have breast implants, which means there is a big interest out there. When do these hit the market?
Well, both manufacturers have been given letters saying that with appropriate conditions, training, follow-up, and so forth, the FDA plans to approve their silicone gel breast implants for marketing. When that occurs is anybody's guess. It could be.
Do you have a rough estimate?
Could be weeks, could be months, it could be years. It's taken years to get to this point.
Just as long as the information is out there and we're getting the right answers that we need to do it
Absolutely.
safely. Thank you very much for being here. We appreciate it. Good times this morning, good information. If you would like more information about this, or maybe you would like to talk to Dr. Nachbar yourself, you can reach him at 480-314-1574. Also, there's a website there. It's nachbar@plastic.org.